Hello, I am Elizabeth Abbruzza. I'm the clinical director of the Bellevue Trauma Recovery Center here in the greater Seattle area. And today I'm sitting down with Dr. Vazquez, who is the founder of Emotional Transformation Therapy, or ETT, which is the main therapy modality that we use here at the BTRC. And we're just hoping to have a conversation about ETT and bring some more information to prospective clients and clinicians who are potentially interested in getting certified as well. Hi, Dr. V. Thank you so much for sitting down with me this morning.
Yes, I'm happy to be here.
Amazing. So if you're ready, I'll just jump right into my first question.
Certainly.
Awesome. Okay, so my first question for you is, how do you introduce ETT to prospective clients or someone who is generally new to therapy?
So I have to start with, this is not a pill. It doesn't leave you dependent on the pill or have side effects at all. And it appears in our cases to work actually faster and helps to get people over things rather than just to temporarily make them feel good. And so that's one of the things that I compare to is the use of pharmaceuticals, since that's the most popular thing people do. I think that you have to be in person with the person to understand them and feel a bond with the people that you're working with. And that's kind of hard to do when all you do is give them pills. So pills have their place, but a lot of people assume that it's necessary because they think they have a chemical imbalance or whatever. And there are other ways to change brain chemistry besides medications. And so this is a very fast way to work. It's not just talking forever and going to 100 sessions in a year. It's not like that. It moves very quickly, but it is a form of talk therapy that's sped up by using visual brain stimulation. That's what makes it unique. It's a very fast way to work, get people over things quicker than they might imagine. In fact, that's one of the problems is it improves people so fast that they're often disoriented because they don't expect that to take place. But in our field, the history is started with Freud using analysis, and that's a very slow, long process, and it's given a lot of people the impression that counseling is always very slow and takes a long time. And
so what you're saying is that it's fast acting and lasts.
Yes.
Right?
Yes. Emotional distress sometimes can be relinquished within minutes, which is not what people know about, generally speaking.
Yeah, it's pretty incredible. So how would you introduce ETT to a new client? Say a new client comes into your office, you sit down for the first session. What are you sharing with them about ETT before actually beginning the therapy?
Well, first of all, in our licensure, we have to give the research we have about it, the explanation about it when they fill out the new client forms. They get all that information at the very beginning before I even meet them. And then they come in and I ask them, do they have any questions about that? And then I'll try to explain it to them further, see what their questions are. So they get a written review of what it is and how it works a bit before they even come in. And so that's the easy way. And typically they don't have many questions, but sometimes they do. They don't understand how visual stimulation is going to make any real difference sometimes.
Could you speak to that a little bit more? Explain here for anyone watching, potentially prospective clients or clinicians interested in getting trained, what does visual stimulation do in the context of this therapy?
When light enters the eyes, it circulates throughout the entire brain. Billions of nerve cells are occupied by visual stimulation. What I've been able to do with ETT is to steer the specific type of visual stimulation to specific parts of the brain that are responsible for the problems that people have. And so it speeds up the process through that means. So it's not just visual stimulation. Of course, they're talking and expressing themselves as well. So it adds to the interpersonal process.
And I know, obviously, as an ETT trained clinician myself, that color plays a big role in this intervention. Could you speak to that a little bit? What role does color play in emotional transformation therapy?
Well, color is activates the brain in certain ways that causes memories and emotions to come forth that the person wasn't previously conscious of. Now, the color we use is very specific. You're not going to get the same effect by seeing colors in the room as you will with this. We have, for example, a device that can access over 16 million different colors. So
a lot of colors.
Yeah, so it's very precise, and it's used, if used carefully, it will activate the brain in the exact ways we want it to. And then other methods we have uses the angles at which light enters the eyes, which makes a huge difference. And that's a more subtle process. And then there's the eye movement process we use that we use colors with, and they're very specific. For example, one of the colors, we only could get it in England. We couldn't find it in the United States.
Wow.
And so I'm very picky about being precise about the colors because we want it to affect the brain in exactly the way we're intending. And so there's a lot of different visual stimuli we use, and they're all quite profound. They're not like you're not likely to see. We have a spectral chart with 7 major colors. The colors you see in this chart is not like the colors you see in everyday life. There's a quality to it of depth, and the colors themselves are highly saturated. So we've picked specific visual stimuli that can affect the brain more. Now, color by itself does affect the brain, but this elevates it.
Incredible. And what clients, Dr. Vazquez, what clients do you find benefit the most from ETT? Or is there a particular client that you would refer to ETT maybe more so than traditional talk therapy?
Well, the book that we use to make diagnosis, the DSM-5, has all the diagnosis, depression, anxiety, all the different things. The vast majority of symptoms in that book are emotional in nature. And what we do best is change emotional states. So that's the key to it all, is that a lot of things, for example, in cognitive therapy, they try to get you to think differently. So as a result, the emotions would be changed. Well, we go directly after the emotion and change it. And that's usually where people are stuck. They want to feel better, and how they feel bad is they're anxious or they're preoccupied thinking about things and so forth. So if we can target that directly, they get relief pretty quickly. So I focus on the emotion. That's what we focus.
Yeah, and part of what I hear you saying is that one of the reasons that ETT is so quick and effective is because you go directly to the emotion. And really, emotional distress is at the core of most, if not all, mental health issues.
Right.
So ETT really is applicable to and beneficial for all prospective clients.
Well, I wouldn't say, there are some things that are symptoms that are not emotional in that list, but it's the majority. So it can be applied to so many different things where emotional distress is the key component.
And there are a lot of other, therapy modalities and specific trauma therapies out there. What makes ETT different than EMDR, for example, another really popular therapy modality in our field?
Well, EMDR is very good, and it opened the eyes to a lot of people because they knew that it worked without medication. It worked without, a year-long analysis and so forth. Here's a list of a comparison of EMDR and the ETT modalities, how they're different. Technically speaking, EMDR uses the same bilateral process with all clients. Basically, I would compare it to if you're building a house and you have a hammer. Hammers are very useful, but it's just one tool, and it can't fix everything. So they have basically one process where we individualize the direction of eye movement, for example, and the type of eye movement. And we have 4 modalities that we use, which is very different. EMDR basically has one modality. The moving of the eyes or tapping of the body can be done either way, but they think that can solve everything. It is good for a lot of things, but we just have much more variety to individualize it to each person. For sometimes some types of visual stimulation are overstimulating for people, so we have processes that are not overstimulating,
Yeah.
and we individualize it that way. And so it's very different than EMDR in terms of the way that we individualize it and the number of different modalities we have. And so my experience, my observations is that it changes the emotional stress faster. They use psychotic eye movement. We use smooth pursuit. Um, and they use basically one or two colors in some of their processes. We use a big variety, like I said, over 16 million potentially. And EMDR is not dependent on verbalization. Ours, you do verbalize the distress you feel at the same time the visual stimulation is taking place. So that's how they're basically different. And actually, they look totally unlike each other if you saw the process of both of them.
Yeah, in practice, very different modalities.
Mhm.
How would you define trauma? What makes something a traumatic experience?
That would be difficult to do it quickly, but when trauma occurs, your fight, flight, freeze activation usually takes place. Is a protective mechanism, and it may get you to where you're not engaged in whatever the trauma is, or it's a consequence of a trauma. And so often what happens is that the trauma gets embedded in your psyche and shows up later as post-traumatic stress disorder.
Yeah.
So there's acute trauma. For example, if you were just in a car accident and you came into my office, that's acute trauma. It just now happened. PTSD is not labeled PTSD unless the trauma has lasted over 6 months. And so it's something that's lingering, and it makes you very hypersensitive to anything that would trigger or reactivate the trauma. And then there's complex trauma. These are people that I see the most and that ETT is the best for. Complex trauma often involves multiple traumas, from early childhood traumas to adult traumas to everything from car accidents, being raped, have your heart broken by the love of your life. There's a whole variety of ways that people can be traumatized. And so those are just some of them. But what we mostly work with is PTSD. Sometimes people think that they're okay after a trauma, but they have new symptoms that keep showing up throughout their lives, and it affects their self-esteem, self-perception. They see themselves as somehow not adequate subsequent to that. And then they're on edge and they expect more traumas to take place. And in fact, that does happen in a lot of cases. One trauma makes a person on edge, and they seem to be more susceptible to further ones. So complex trauma, you have legal complications, you have medical complications, you have multiple traumas, you have family of origin issues. So that's why it's called complex trauma. And there's so many things that could all happen in one person that you really need a strategy that works efficiently, because otherwise you'll be in therapy for years with that.
Right. And correct me if I'm wrong, Dr. V, but part of what I hear you saying is that trauma is not necessarily the event, but it's the way that our brain and body respond to that event.
Yes. For example, panic disorder. To the person that's in the midst of panic disorder, it is traumatic. Now, maybe nothing happened to produce the trauma, but the panic just occurs to them. So I see panic disorder as both panic disorder and a traumatic event. It's not listed that way, but it feels like a traumatic event to that person.
Yeah, absolutely. So pivoting just a little bit here, maybe to talk to clinicians who are interested in getting trained. I'm curious as to if there are certain clinicians or clinicians who have certain interests who you might find are the best fit for integrating emotional transformation therapy into their practice.
Ooh, I got a long answer for that one.
Wonderful.
So there's a broad array of conditions and a very specific type of procedure to go to correct each one of them. And so that's why I'm saying there's so much to say. If they have complex trauma clients, this is probably what we do the best. But it's also particularly good for somatic symptoms. A lot of people, their emotional distress shows up in physical symptoms. I'm not talking like a broken leg per se. I'm talking about, there's stress that you feel in the back of your neck, or digestive problems that are a consequence of emotional distress. So we've been very successful working with a lot of medical conditions that all we're doing is working with the stress component of illness, injury, and physical pain, but we do it effectively and very efficiently. And so when we correct that stress that's directly related to a medical condition, often the medical condition gets better. We can't go around saying we're physicians, we're trying to cure the medical thing, but when you cure the stress component, it goes a long ways toward correcting it. And that's usually what's not done in medicine. They don't really process change the emotional distress related to a condition.
And I know in my own practice, Dr. V, which I'm sure you've experienced as well, I have so many clients who come in, I specialize in the treatment of complex trauma, who come in with autoimmune disorders or fibromyalgia or chronic pain, or even kind of mysterious medical conditions where they've had all this testing and, haven't been diagnosed with anything, that the doctors just can't find anything diagnostically wrong. And I have found that ETT is so effective working with that type of chronic pain as well, because oftentimes when doctors can't find a specific diagnosis, it's even more likely related to emotional distress.
Right. So that's what I look for. What emotional distress is involved in these conditions? If we can change that, it may completely change the medical condition, or at least partially change it, because that component is overlooked. And we have a way to get directly after the emotional component, even if it's consciously buried. We can do that. And so that's why it seems to change the physical body so much. I think if medicine knew about it, I think that it would revolutionize it, because they all agree. The research is clear that these conditions are stress related, but nobody does anything with the stress component, directly. Maybe you can support them by hearing about it, but not directly the stress that's related to that particular condition. Anyway, so that's something it does pretty powerfully.
So really great fit for therapists who treat a lot of clients with complex trauma, chronic pain, really any level of emotional distress, which
Right.
in a lot of ways is every client that walks through our door.
Yeah, we look for where's the emotional distress and follow that and try to facilitate change there.
And this actually kind of segues into the next question, is that the outcomes of ETT are oftentimes outside of what our industry describes as normal. I think, and I know from personal experience, when I learned about ETT and started integrating it into my practice, it is pretty profound. And I'm curious as to what you say to ETT skeptics out there, the people who may say, wow, like this just sounds like, too good to be true.
Yes. Too good to be true is probably the number one criticism. When I do presentations, live presentations, I will usually do a live demonstration with somebody I never met before. And what's interesting is when the audience sees it, they still don't believe it, even though I did it right in front of them. This tickles me because I see this all the time. I was at a major addiction conference and I had a volunteer. I did a live demonstration with a man that was a sexual addiction in his case. And it was gone in maybe 30 minutes. And I mean, a whole group of addiction specialists saw this. They still didn't believe it because their experience is that addiction takes, a long, long time and lots of relapses. I happened to see this gentleman a year later in the LA area, and he was still good. Now, all of my addiction work doesn't take place in one session, but this one actually did. And another case I did at a statewide conference, 70 people in the room. I asked for a volunteer. Woman had chronic depression. This took 5 minutes on the spectral chart. It took 5 minutes and her depression was gone, but she was confused. She had an odd look on her face. That's one of the things you have to deal with, is that people are going to have to adjust, because it's amazing how they can discredit when they see it done right in front of them. And I just think that all the years of training about how things are supposed to work, it defies that. And so it confuses them. But I give them factual evidence, research, do a live demonstration, and I'm confused sometimes as to why that doesn't convince them. Because, I mean, I've had them, after I did several live demonstrations in one group in California at a conference, several people followed the people out of the room that I did the demos with and asked them if they knew me before, if they faked it for the purpose of the group. I mean, and of course they all said no, I never met them, but it's just that hard to believe. So this is one of our major obstacles. It's hard for people to believe it until they see it. Even when they see it, they find some way to explain it a different way. So this is a common issue here. So I sometimes tell clients when they first come in, okay, now this may work faster than what you've ever experienced before. Or do you really want this to happen? Would you like to get better quicker? I try to set it up ahead of time to get them ready for that possibility. Mm-hmm. So that's one way that I reduce the angst about it's too good to be true.
And where can people find the research that you've done over the years about ETT? Is there a resource that we can look to?
Well, I've written 3 books that's loaded with research. Some of it is about research of components of ETT. There's currently ongoing research about ETT itself, and we need a lot more. Mm-hmm. We don't have it is because the discoveries have happened faster than we could do research for them. In other words, if you have discoveries of 27 different conditions, you've gotten better. I mean, I don't do the scientific research per se, but we've got to get people on board to do that, and that's a whole long strategy to do. So I have a lot of substantial research that supports everything we do, but we're looking for more research. And so if there's researchers out there watching this, you're invited. We want you.
Need you. And so we can find this research in the books that you've written, which I know that people can purchase on Amazon. Would you remind me, Dr. V, what is the title of the first book?
The first book is Emotional Transformation Therapy.
Wonderful.
That book, can be purchased on Amazon, or we can purchase it from us at a reduced amount. We have some books available.
Well, that is a much better option than Amazon. We'll purchase directly from the ETT organization.
Yes, that's right. And plus there's 2 other books too that cover different topics. But the first one is the basic one, I think would really help people really understand what it's about.
And if therapists are interested in learning more, looking at training schedules, signing up to potentially get trained and certified in ETT, where should they go? Where can they find that?
Our website has that information. And if we're not covered all over the country, so there are places we need to have some ETT practitioners. Mm-hmm. So anybody has a group of people, let's say, for example, in Detroit, which we don't have anybody there. If you get a group together, we'll send teachers out there and teach you. So we're ready and willing to teach it. It's been taught in Europe as well as here, and we have one of our teachers that's in Europe at the moment to teach it there. Incredible. But we're mainly in Texas and the California area and a few other areas, but we're trying to get known all over the country.
And that website, I believe, is www.etttraining.com. And so that's where you can go to find all of the training schedules. And like Dr. V said, if you're interested in getting a group together, reach out to the ETT organization. The ETT team can work with you to schedule a training in your area. I know we will be hosting ETT levels 1 and 2 training here in the greater Seattle area in 2024, which is very exciting. So if anyone is interested in that, you can reach out to us as well. Mm-hmm. What about Dr. V, kind of just to start to wrap things up here, what about prospective clients? Say they watch this video and they're like, oh my gosh, ETT sounds like it's something I need. It's for me. How can they find an ETT provider?
On our website, we have a list of them and what they do and where they're located. And so that's why we have the website, for that information.
It's got everything you need. So you can find training as a prospective clinician, all of the research, your books, and then also there's a directory of ETT therapists, which is incredible.
Mm-hmm.
Is there anything else, Dr. V, that you would like to add or share that we haven't covered?
What we get a lot is people who have tried lots of therapies, maybe 10 different types, and they're still not better. So we get them after that often. I would like to get somebody before that sometimes, and sometimes I do get brand new people that have never been to therapy before. But generally, don't give up if you've been through lots of therapy for a year or two or whatever length of time. Give us a shot. It's another option for you. So that's probably one of the things I see. Maybe half of my clients are clients that have been through a lot of types of therapy, been through EMDR, they've been through talk therapy of various types. So, but trauma is so unpleasant to live with. It's just wonderful to have an efficient way to get a person over that quickly.
Absolutely. And I know for some of the clients that I work with, they would prefer not to be on medication, right? Or they don't want to use pharmaceuticals to help support their mental health. They would prefer other treatment interventions. And so I think that ETT is also a really great option for those who don't necessarily want to take psychiatric medications.
Right.
Gives a lot of hope. It's given a lot of hope to my clients. It's given a lot of hope to me as a clinician to be able to support the people who walk through my door. So for those of you in the greater Seattle area or even anywhere in Washington state, you can find my practice at www.thebtrc.com. We currently have 3 clinicians who are level 4 trained in emotional transformation therapy, and we are accepting new clients, especially clients who are interested in participating in ETT. So if you are local to our area and want to learn more, feel free to check out our website and you can schedule a consultation there. And then, of course, for any prospective clients anywhere in the country, take a look at www.etttraining.com and you can find hopefully a local clinician in your area. And then just that one last plug for therapists who we need more across the country. There are definitely pockets that could use more ETT therapists. So check out the training schedule there as well. Or if you're interested in research, it's another plug there. Always researchers. So Dr. Vazquez, I just want to thank you so much for sitting down with me today to answer some of these questions. I'm a huge proponent of ETT, as is my clinic. We're just so grateful for everything that you have done for our field. Our clients are grateful, and we are on a mission to spread ETT as far as we can and just make information more easily accessible to people, which is part of why we're having this conversation today. So thank you so much. I really appreciate it.
Well, thank you. I loved it. I hope it helps somebody, and I appreciate your appreciation. Thank you.
Thank you so much.